This talk is an overview of the diagnosis of somatic symptom and related disorders. This talk will review the diagnoses in the somatic symptom and related disorders chapter of the DSM-5, along with additional related concepts. These disorders all have in common somatic symptoms, also known as physical symptoms, associated with psychological factors. These disorders include somatic symptom disorder, illness-anxiety disorder, functional symptom disorder, factitious disorder, and malingering. Let's start by reviewing the key features of each disorder. Somatic symptom disorder involves one or more somatic symptoms with excess attention paid to them. These symptoms can occur in any organ system, for example, cardiac, gastrointestinal, or neurologic, but the key feature is that the symptoms are distressing, cause impairment, and lead to excessive thoughts, feelings, or beliefs related to the symptoms. Illness-anxiety disorder involves preoccupation with having or getting an illness, despite having no symptoms or only mild symptoms. This disorder features anxiety that is clearly disproportionate to the actual severity of current symptoms or to the actual likelihood of getting an illness. There are also excessive health-related behaviors, such as repeatedly checking one's body for signs of illness or attending numerous medical appointments. Functional symptom disorder involves physical symptoms that are not explained by recognized medical illnesses. For example, seizure-like episodes that do not correlate with EEG changes. Though the cause of functional symptoms is not fully understood, it is generally thought that psychological factors, such as stressful life events, are major contributors. The DSM-5 only lists functional neurological disorder, but there are other kinds of functional disorders, including functional gastrointestinal disorders. Factitious disorder involves falsification of physical or psychological symptoms, even to the extent of causing physical illness in oneself, for example, by injecting oneself with toxins. This is done deceptively and without clear secondary gain. Secondary gain refers to external benefits from having illness, such as time off from work, disability benefits, or the shelter of a hospital. In the case of factitious disorder, it is thought the patient is seeking primary gain from being in the sick role. That is, the psychosocial benefits from being identified as a sick person, such as extra attention. By contrast, malingering refers to falsification of physical or psychological symptoms to obtain obvious secondary gain. Note that malingering is a behavior, but not a diagnosis in the DSM-5. Next, let's walk through how to differentiate between these disorders. These disorders can be differentiated based on the underlying cause of their physical symptoms and based on the associated psychological symptoms. The cause of symptoms are either a true medical illness, unconscious psychological forces, or self-inflicted or feigned symptoms. If the symptoms are due to a medical illness and the patient obsesses over the symptoms, then this is somatic symptom disorder. If the symptoms are due to a medical illness and the patient has significant anxiety related to the illness, then this is illness-anxiety disorder. If the symptoms are not due to a known medical illness and appear to be associated with significant stress or other psychological factors, then this is functional symptom disorder. If the symptoms are self-inflicted due to seeking primary gain, then this is factitious disorder. And if the symptoms are self-inflicted due to seeking secondary gain, then this is malingering. I'll conclude by outlining two other related concepts. First, delusional disorder can also involve somatic symptoms if the patient believes there is something wrong with their body despite no evidence in support of this belief. One of the most common forms of this is delusional parasitosis, in which the patient believes they are infected with parasites. Second, there is a DSM diagnosis called psychological factors affecting other medical conditions, which refers to when psychological factors adversely affect the course or treatment of a medical illness. For example, if the patient is so anxious of needles that they are unable to receive necessary medications. That's the end of this talk. Thank you.